Hello everyone, it's me again, Dr. Adekemi, and welcome to another episode of Let's Talk Mouth. In today's episode, I'm going to be talking briefly to you on teething and teething myths that are common. And after this video, you could probably share teething myths or myths around teething in your culture that you want me to address. When it comes to baby's teeth coming out, there are several things that are, I call them old wise tale that are being spoken, or fairy tales that have been spoken around a baby teething. And the number one thing that is common is that when your baby is teething, it's normal to have a fever, it's normal to have a diarrhea. That's so not true, because the truth is, yes, when your baby is teething or when their tooth is erupting, what happens is there's slightly an increase in temperature for your baby, but it's not strong enough to increase, or should I say, to spike a fever. When your baby is having a fever, it's an indication of something else. So as much as possible, get them to the doctor. Don't excuse it away by saying, oh, it's teething, it's because they're having their first tooth erupt. That's so not true. Yeah, the thing is that, most times when babies begin to when the baby's teeth begin to come out, babies are used to putting a lot of things in their mouth, and most of those things are not clean, and which at times can lead to some other health problems like diarrhea, like fever, or an infection that can spike a fever. So these are the common things that often happen in teething, because most times when your baby is teething, they just want to get things into their mouth, and those things sometimes introduce should I say, infections, bacteria, viruses that could cause other health problems. So when your child has a fever, even when they're teething, please get them to the doctor. When your child has diarrhea, even when they're teething, make sure you get them to a doctor. Don't excuse it away. Do you get it? Another common thing is that it's okay for your child to eat less because they are teething. Yes, children may feel a little bit uncomfortable with their gums when it's teething, but it's very, very important that you feed your child. You keep feeding because food is good to get nutrients into your child's body, vitamins into your child's body. So don't stop feeding them just because they're teething, just because their tooth is erupting. Another common myth is that parents tend to introduce what we call gels that numb the gum so that the child is not in pain. In some cultures, you get some herbs to rub on the child's gum. This can be very, very dangerous for the child's gum and also for the child's health. Especially when your baby is still growing, you need to make sure that they are taking the right food and taking in the right thing. As much as possible, try to clean your baby's mouth so you can help relieve them of whatever pain or discomfort right at that moment. More of a discomfort than pain when they are teething. It's very important. Know if your child, because most times when it comes to teeth erupting and teething period, your child gets their first teeth between the age of 4 and between the age of 4 to 6 months. Wait, it's not a problem if your child starts erupting earlier, or it's not a problem if your child erupts later. It doesn't mean that there's something wrong. Get it? It just means that maybe for some reason their teeth is coming out earlier or coming out later. So that's not a problem, but you can still use a gentle washcloth. Sometimes you can freeze your washcloth. Please make sure that you don't put a frozen washcloth in your baby's mouth. It's just to make it cool a bit, so that when you rub it on your child's gum, it relieves of the discomfort. But as much as possible, when it comes to teething, it's a period that eventually goes away. So there's really nothing to worry about unless you spot something like a fever or diarrhea for your child, which means that you need to take them to the doctor immediately to check to be sure that there's nothing else that is causing the fever or the diarrhea. Another thing is, people say, oh, my child is just 4 months, 6 months, they don't need a dentist. The truth is, introduce your child to a dentist as early as possible. The moment your child starts eating or brings out their first tooth, it's good to get a dentist that can help you check to be sure that your baby's teeth erupting properly, and to be sure that there are no ulcers or other problems in their mouth. So get them used to seeing a dentist, get them used to cleaning their mouth. It's very, very, very important. And when it comes to other teething myths, what other teething myths do you know about the baby or about babies in your culture? Share with me and maybe I can talk about it. See you next time on Let's Talk Mouth as we dive into how to get your toddler or how to get your baby to love brushing their teeth. Yes, love brushing their teeth. See you sometime soon again. Subscribe. Thank you. Bye.